It's time for another installment of Flashpoint. This week, David Hall sits down with guests from Osceola Regional Medical Center and talks about how mental health issues can affect the community this time of year.
Good morning, Central Florida. I'm David Hall. This time of year, the winter months can bring seasonal depression, but with the right help and some treatment, there are ways to counteract feelings and improve your overall outlook, physical health, and emotional well-being for a healthy and happy winter season. Joining me this morning, we have Dr. Hanish Sethi, a psychiatrist with Osceola Regional Medical Center's Behavior Health Center, and also Marielle Asencio, lead social worker for the Intensive Outpatient Program and Partial Hospitalization Program. That's a mouthful. Welcome to Flashpoint. How are you both doing?
Thank you. Good doing.
Yeah, thank you both for joining us. So, Dr. Sethi, why do people tend to feel more depressed during this winter season or during the winter season?
Well, David, winter or fall season brings a lot of joy for some, but it brings a lot of depression and anxiety for many of the patients. There's a multiple theory behind it, but what it brings is to the neuropathology of the depression is it eventually triggers down to the symptoms of more anxiety and depression seen in our patients' populations. Particularly around this winter month, if somebody has experienced a recurrent sign of depression, which I'm going to share with you in a minute, certainly it's a more clinical disorder than just a winter blue.
Okay, and with that being said, what can be done to fight that lonely feeling if someone is dealing with that?
Well, I think, David, early recognition is very important for people to know what symptom and what sign it comes into it. I can share with you what I've seen in my practice. People come with emotional symptoms of being withdrawn, sadness, not happy, not joy, when the winter and fall is a time of joy for most of the people. It also leads to some subtle symptoms like irritability, withdrawn, not enjoying the social life, a cognition problem like not able to focus or forgetful easily. If it goes on, then it becomes more somatic problem like drifting to the pain disorders, or weakness, or tiredness, or lack of energy, and so on. So if you recognize the emotional symptoms followed with some cognitive symptoms, attention, focus, and then somatic symptoms, if you recognize any of these, I think this is an early sign of depression.
So it's very important to pay attention to some of those subtle signs, those important signs, early signs.
Yes, yes.
Okay. Now tell me this, the U.S. Preventative Services Task Force recently advised that all physicians screen all adults for depression and treat those affected by mood disorder. Do you see these screenings as beneficial, and if so, why?
Well, screening brings is very important, as I said, early detection of these disorders, because in many of the studies have over and over have shown that early recognitions, early intervention bring better prognostic, better improvement, and very quick improvement. If you diagnose this depression early into the illness, you can treat with one medication or combination of therapy. If you get too late, like if it becomes 3 months or 3 subsequent episodes, it becomes more difficult. Or require more intervention for medications and or multiple therapies.
Okay, doctor, thank you for the info and the advice. And when we come back, we'll talk more about the mental health services at Osceola Regional Medical Center. We'll be right back. Welcome back. So today on Flashpoint, we're talking with Dr. Hanish Sethi and Marielle Asencio from the Osceola Regional Medical Center. They're here both to talk about the feelings associated with seasonal depression and also the treatment options available for you. Now, Marielle, would you recommend seeking treatment, and how can viewers determine whether they should receive any treatment?
Well, David, just like Dr. Sethi said, early detection is important, and early intervention to treat the symptoms. The sooner clients and consumers are able to introduce themselves into the programs and assessment therapies, it's important. We can help them with assessments. We can help them with a tailored treatment plan for their individual needs, and so recognize what are the steps to improve their overall health.
The sooner the better.
The sooner the better.
Now tell me this, are there any symptoms that patients often dismiss because they don't see them as signs of depression?
Absolutely. There's subtle symptoms, kind of lack of energy, isolation, a lack of interest in social activities. Workloads tend to be more overwhelming and unable to produce in their work environments. So those are symptoms that you may think that, oh, I'm tired or something's going on, but those are subtle symptoms that we need to pay attention to because those could be increased with more pressure and the symptoms of depression or anxiety.
Now, for those looking for help or treatment, what kind of services do you all provide at Osceola Regional Medical Center's Behavior Health Center?
The great news about the services that I'm very excited about to share is that we are kind of like a one-stop shop. We have a medical system that can early intervene with an emergency room visit if you are feeling anxiety, a panic attack, any symptoms that patients may not be describing as an emotional or mental health symptom will be screened with a medical professional. Quickly after that, we have an intake at our behavioral center where then our professionals, our specialty behavioral health, psychiatry, therapists can go and assess those patients quickly rather. And then right after that, decide if an inpatient admission would be warranted based on symptoms. That is in the behavioral health unit to assess those emotional needs. If not, we also provide outpatient services where patients can be referred for individual and outpatient treatment for these symptoms. So we are early on detecting those symptoms and introducing ourselves to the community, to the consumers, so that they can feel comfortable seeing the same faces that they're going to see in the inpatient or outpatient settings.
Making someone feel comfortable goes a long way.
It's all about the continuation of care, and we work really hard on making sure that those patients are engaged so that they can feel comfortable and gain a sense of control over their symptoms.
We've been talking about patients and people in need this whole time, so tell me this. What's the main impact that you both have seen in your community?
Well, with the hospital and with the behavioral health program being all in one together setting, the community is seeing that at least there's one more place where they can go, be screened, be treated, inpatient or outpatient, any kind of referrals. They don't need a doctor's prescription. We will see them with an evaluation to then tailor their treatment plans if needed for their treatment.
Okay. Now, in terms of you, doctor, what have you seen in terms of the overall impact?
Well, where we are located in the community where we provide complete, comprehensive psychiatric care, which include assessment of the psychiatric needs as well as medical needs, help that many of the patients can be served at the one location. As Marielle says, that continuity of treatment, not only just discharging the patients into community, now we do a bridge program, which is a partial hospital program, which is a design for completing comprehensive therapy program, where individually can go into the groups setting where they can learn different ways of coping skill, assertiveness, communication, grief, anxiety, and so on. And that helps them to go to the next level, which is outpatient by themselves. So this community has been served, where we are located in Kissimmee is much needed, where I see people don't follow up. We educate them that how important it is to keep their first appointment. And most of the people don't understand that, and missing the first appointment leads them to the relapsing into their illness.
Well, hopefully they're watching and listening to everything you both are saying.
Well, thank you.
So
David.
thank you both for your time and the advice and the information.
Thank you, David, for having us.
Anytime. That's it for Flashpoint. Thank you for joining us. Back to you in the studio.